Want me to look a certain
We're
place?
starting. Today is September 5th, 2018. This is Cheryl. Hi, Cheryl.
Hi.
Cheryl, could you just briefly share your story with the listening audience? So Cheryl came in about 2 months ago, correct?
Correct.
Complaining of right knee pain.
Right.
And Cheryl, do you want to share how much pain you were in with your knee and kind of what was happening and what brought you into the office?
I had a lot of pain. I was really afraid that I'd have to have surgery.
What type of surgery?
Knee surgery.
Like replacement or what?
I didn't know.
Okay.
But yeah, it was painful, and I was afraid of being put on strong drugs and having knee surgery. And so I saw Dr. Sevlie on the internet, and I decided to make an appointment, and I came in, and my pain was probably anywhere from a 7 to a 10. And
with what? With movement?
Movement, constant pain.
What was it worse doing? What was it worse, like climbing stairs or just walking, or kind of what were the activities that really irritated
walking or just moving it? Like if I was just elevating it, it would not be as bad, but it was still painful. It was painful all the time.
Sure.
Mm-hmm.
Okay.
But it got worse with movement.
Yep. So then what happened? You found us on the internet, you said?
I did.
Okay. And scheduled appointment, and then what happened?
Well, you took an x-ray, and you saw that I had almost bone on bone.
Yes.
That my cartilage was almost gone.
Yes.
And we started very intensive treatments.
Cheryl, could I just interrupt you just for a second and show the model when we're talking about the bone-on-bone situation? So this is a model of different stages of osteoarthritis. On the left is normal, healthy joint tissue and healthy cartilage in the knee joint. And then as a person begins to have damage in the knee, what happens is you begin to get injury to the articular cartilage, and it's shown by this red area of rubbing and inflammation and breakdown of the cartilage. And then as that advances, that area of injury enlarges, and it actually can start involving both sides of the joint. You can see it, the red being on both the right and the left. And then that's a moderate degree of damage. And then if the process continues, as Cheryl was mentioning, you can get severe articular damage where those two red areas are. And then the medial and lateral meniscus, this pad right here, begins to wear and degenerate. And then you start getting bone growth and or spurring, which is shown here versus smooth and natural here. So Cheryl, when we took her x-ray, was somewhere between moderate to severe degree of damage in her right knee joint. So go ahead, Cheryl. So then kind of what was therapy all about? Kind of what did it consist of?
Well, I come 3 times a week, and it's extensive. I take lots of natural supplements. Thank you.
What are they designed to do?
To help build the cartilage.
Yes.
And also just make me more healthy in general.
Mm-hmm.
But I get acupuncture, I get chiropractic care, I get ultrasound, I get laser treatment, and that's 3 times a week.
And the pulsed electromagnetic field therapy.
Yes, the beamer, yes.
Yes, yep. And so what's happened?
Amazing. So amazing. I was told many years ago that I had runner's knee. And it got worse and worse and worse, and that's when I came to see Dr. Sevlie, and that was probably a 7 or a 10, depending on my movement.
Mm-hmm.
And now it's down to a 1.
A 1?
Yeah.
So
every once in a while it might go up to a 2 or 3 if I accidentally move a little wrong.
Mm-hmm.
But Dr. Sevlie has helped me even with that and moving properly, and even though it's an extensive treatment, it's well worth it.
So, Cheryl, can you tell me, when we did your exam, we saw that your arches had also collapsed.
Yes, and I was surprised about that.
Yeah, you were unaware of that.
I was unaware of that.
Yeah, and so Cheryl had basically fallen arches, which contributed to her knee pain because she was actually walking on the inside of her ankle joint, and that put added stress on the inside of her right knee joint. And so we fit you for a set of orthotics, custom-made orthotics. And how's that gone?
It is a slow process for me. I had to go little by little to get used to them, starting with like 20 minutes 2 times a day and increasing every week or so. And now they're at the point where I prefer to use them. And
can you feel them lifting your arch?
Absolutely.
Yeah.
Absolutely.
Does it feel like it's taken stress off your knee when you have them in?
Absolutely.
Okay.
Absolutely.
And you had worn a generic form of an orthotic, right?
I had them. I didn't wear them all the time, but yes.
Yeah.
And they helped a little, but not like the professional ones or
More support.
Right. Much more support.
So how much improvement would you say you're at then? 0 to 10, did you say? 10 is 10 is severe pain, unbearable, can't move or walk. 0, it doesn't hurt at all when you're doing normal life.
A 1.
A 1. And how long can you go? Last question, second to the last question. How long can you go being now on your feet, from the standpoint of your endurance? Initially, just being on your feet for an extended period of time would aggravate the knee joint. True?
Very true.
So how long, when you started, could you be up on your feet doing life?
No.
How long could you be on your feet?
When I first started, it got to the point where I pretty much had to just elevate my foot most of the time.
So you couldn't even stand around and do work in the house or do anything like that?
Not without pain. I did because life happens. But no, not without pain.
And now from the standpoint of being on your feet, doing your stuff around the house, all the different activities that you're responsible for, how long can you be on your feet without it really saying, look, I got to sit down and get off my feet?
It's to the point where I don't even really notice it, and I purposely go and rest by doctor's orders, and I have to think about I need to go rest because it's important for my recovery, but you're not
hurting.
I can go about my daily business, and like I said, it's about a 1. I'm aware of it, but it's not painful.
Sure. Do you have any advice, Cheryl, for future patients or people who are suffering from knee pain, wondering, is there any natural alternatives, for relief, or do I just have to go have surgery or get a knee replacement or whatever? Do you have any advice?
Absolutely try this first. Absolutely try it first. And, it's a lot of commitment, and, I won't pretend it's not.
Yep.
You have to be very consistent. You have to do exactly what Dr. Sevlie tells you to do. So it is a commitment not only in the office but also at home, but it's well worth it.
Good for you. Cheryl, I'm super happy for you. Cheryl's just starting her strengthening exercises now as she enters the 3rd month of her recovery process, and that will start today, right?
That will start today.
And we're going to take it easy and not overdo it.
Right.
Yeah, so great job. I have to just say Cheryl has crossed her T's and dotted her I's as I've asked her to do certain things, and she's been very careful, and she's seen a really nice change. So Cheryl, do I have your permission to share your story with doctors, students, or patients anywhere?
Absolutely.
Any restrictions on that?
None at all.
Cheryl, super happy for you. Great job. Thank you.